Today's topic is posterior abdominal wall. Now, in the last week, if you remember, I have started with the abdominal region where I have shown you the abdominal cavity. If you remember, I have shown you the abdominal cavity. Along with that, I have shown you if a cavity is there, then the cavity is having certain boundaries. Anterior boundary is there, posterior boundary, superior boundary and inferior boundary. Okay. Now, among them, the anterolateral boundary already we have completed last week. Okay. Next, what is remaining, that is the posterior abdominal wall or the posterior boundary. So today we will be discussing about the posterior abdominal wall. Now, in the dissection hall, once all the viscera are taken out, at that time only you can see the posterior abdominal wall. So I hope you are in thorax now, right? Or in abdomen? In abdomen, okay. So first in abdomen, all the peritoneal folds regarding peritoneum will be discussed, then the abdominal organs. Once the abdominal organs are removed, then you can see the posterior abdominal wall and the structures of the posterior abdominal wall, okay. Now, how the posterior abdominal wall is formed? Okay, so we'll start with the posterior abdominal wall. Now, the posterior abdominal wall is made up of three things. As you can see, it is an osteomusculofacial structure. Okay, now what is the meaning of osteomusculo and facial? Oseo means bones are there. Musculo means muscles are there and fascia are there. So these are the three components which are forming the posterior abdominal wall. Okay, now in case of posterior abdominal wall, these are the three components which are forming the posterior abdominal wall, and along with that we are having some contents. So what are the list of contents that we will discuss, that I will show you, don't worry, but these are the main contents. Now if you see the extent of the posterior abdominal wall, so from where to where it is extending from the last rib. Okay, last rib means which number? 12th rib. So it is extending from the 12th rib to the pelvic brim. Okay, now do you know what is this pelvic brim? As you can see, the posterior abdominal wall, it is extending from last rib to the pelvic brim. Now what is this pelvic brim? Pelvic brim is a area, okay, when you will study the pelvic cavity or when you will study the pelvis, at that time you will come to know that a false pelvis is there, then true pelvis is there. Okay, so in between false and true pelvis, the area which is demarcating, that is the pelvic brim. Okay, so along with the pelvic cavity, you will be studying about the pelvic brim. So that is the extent of the posterior abdominal wall. And what are the components? Three components are there: oseo, musculo and facial. That means bones are there, muscles are there and fascia are there. These are the three components. Okay. Next, you can see the bones. So what are the bones present? In the midline, what do you think? Which bones will be there? Posteriorly, it will be the part of vertebral column. Just imagine the posterior abdominal wall. If you are going posteriorly, okay, so what will be present over there? That is the vertebral column. Not which part of the vertebral column? That is the lumbar vertebra. So as you can see, bones in the midline, that is the bodies of 5 lumbar vertebra. These are present. Okay, now that is present in the midline. Next, if you go below and laterally, okay, if you go below and laterally on both the side, you will be getting the iliac fossa and the ala of the sacrum. Now this iliac fossa and the ala of the sacrum, okay, so this iliac fossa is nothing but the part of a hip bone. Hip bone, as I said earlier, three parts are there: ilium, ischium and pubis. So this iliac fossa is the part of ilium, okay, and then we are also getting the sacrum. So mainly these are the bony structures which are present. Okay. Next, muscles are there. Now the muscles, how they are situated, means what is the arrangement of the muscles. Okay. For that you can note over here, psoas major muscle is there, psoas minor muscle, iliacus muscle, quadratus, lumborum, and then the respiratory diaphragm. These are the muscles which are situated on the posterior abdominal wall. Okay, psoas major, psoas minor, iliacus, quadratus, lumborum. Now, how they are arranged? What is the orientation? Now, if you see the orientation, first from medial to lateral. Okay, from medial to lateral, if you go first, you will be getting the psoas major muscle. Okay, first you will be getting the psoas major muscle. Now we will be discussing about the origin, insertion and actions of the muscle. But how is the orientation? First you will be getting the psoas major muscle. Now this psoas major muscle anterior to this psoas minor muscle is present. Okay, then if you go laterally, quadratus lumborum is there. Next, if you go below into the iliac fossa, at that time you will be getting the iliacus muscle. Okay, next the respiratory diaphragm is also there. So the diaphragm is coming from the anterior aspect, then lateral aspect and the posterior aspect. Like this it is covering, and it is also forming a partition. Now see, it is present anteriorly also, it is present laterally also, and it is present posteriorly also. Okay, so that's why the posterior part is been included over here, right? And this is also forming the partition between the thoracic cavity and the abdominal cavity. Now let me show you a diagram of the posterior abdominal wall. Now here you can see the diagram of the posterior abdominal wall, where you can see various structures are also present. Okay, now first if you see the diagram, I know it will be very difficult because so many structures are there. Okay, so don't worry, we'll simplify it. Directly if you see the diagram of the posterior abdominal wall, I know it's very difficult because so many structures are there. Okay, nerves are there, blood vessels, lymphatics, okay, tributaries are there, branches of the arteries are there, muscles are there. Okay, so the exact picture, it is very complicated. So what we will do, I will make it simplified. Okay, so, and then we will be discussing about the structure, so that you will be having an idea that in the posterior abdominal wall what are the structures present. Okay, now so in bony part we have seen what are the bones present. Okay, after that we have also seen the muscles which are present, the name of the muscle, and last is the facial part, which is made up of fascia. So which fascia are present? So you can see fascia iliaca is there, which is mainly covering the iliacus muscle and the psoas major muscle, and along with that we are getting the most important thoracolumbar fascia. Okay, thoracolumbar fascia. So these are the two facial coverings which are present on the posterior abdominal wall. Okay. Next, in the posterior abdominal wall, following structures are there. As you can see, these are the structures. So first, if you have noticed, I have mentioned that in case of posterior abdominal wall, three components are there, right? Bones are there, muscles are there, and fascia, right? That I have mentioned. Next are the components. That means what are the components present in posterior abdominal wall. So here you can see this is the list of the components. Now before this, just now I have shown you a diagram, very complicated critical diagram, right? So this is nothing but the list of the structures which are present over here. Okay, so abdominal aorta is there, inferior vena cava, then abdominal part of the azygous and hemiazygous vein. Next, lymph nodes are there of the posterior abdominal wall. Along with that, very important cisterna chyli is there. Then muscles of the posterior abdominal wall along with the thoracolumbar fascia. Nerves are also present, including the lumbar plexus and the abdominal part of the autonomic nervous system. Okay. So all the structures, whatever you have seen just now in the diagram, if you make a list, okay, of all the structures, then you will be getting this picture. Okay, so these are the list of structures which are present in the posterior abdominal wall. Okay, now in this class we will be emphasizing more on the abdominal aorta and the inferior vena cava. Remaining things you will see in the dissection hall. Apart from this, we will be discussing in brief about the other structures also. And during the lumbar plexus, as you can see, lumbar plexus, tomorrow's lecture is on lumbar plexus. So Shantanu sir will be taking the lumbar plexus tomorrow. Okay. So already I have shown you this diagram, right? So now we will start with the structures one by one. So which is the first structure which we are going to start? That is the abdominal aorta. Okay. So we'll start with the abdominal. Now before going to the abdominal aorta, I would like to show you the origin, insertion and action of the muscles of the posterior abdominal wall. Okay. So what are the muscles present? Yes, what are the muscles present? First is the psoas major muscle. Okay. So diaphragm is also there. Right, respiratory diaphragm. Now as I said, diaphragm is having three parts. First, anteriorly it is attached to the lower part of the sternum. Then if you go laterally, it is attached to the ribs, lower 6 ribs, and then posteriorly, okay, in the crura of the diaphragm. Okay, so these are the attachments of the diaphragm. Okay, as you can see over here. So Gifford process, lower 6 costal cartilages, and the arcuate ligaments. So these are the origin of the diaphragm. Okay. Next insertion is in the central tendon. So this is very important. So the fibers from the periphery, they are coming, okay, and then they are attaching in the central tendon. Now if you see the diaphragm, it is dome shaped. Two domes are there, right dome and left dome, and on the center, the central tendon is there, where all the fibers come and they are attached in the central tendon. The central tendon is very important. Why it is important? Just above the central tendon, the heart is situated, enclosed by the pericardium. And I hope you have studied that, okay, in the mediastinum. Now it is a chief muscle of respiration, okay. Nerve supply, you can see phrenic nerve, the root value is C3 to C5. Next muscle, as you can see, psoas major and iliacus. So we'll be considering the psoas major muscle and iliacus together. Okay. Now if you see the psoas major muscle, what is the origin? So psoas major muscle mainly arises from the lumbar vertebra. So the bodies of all the lumbar vertebra, along with the intervertebral disc and the anterior surface of the transverse processes. This is the origin of the psoas major muscle. Okay. Now this psoas major muscle, what is the insertion in the lesser trochanter? So I hope you have studied about the femur. Okay. So in femur you have studied the lesser trochanter. So this is the insertion of the which muscle? Psoas major muscle. Now psoas major muscle and the iliacus, as I said, we will be discussing together. As you can see, iliacus, that is floor of the iliac fossa, that is the origin of the iliacus muscle. Now this is also forming a tendon with the psoas major muscle and inserted into the lesser trochanter. Now the tendon which is formed by both the muscle, that is called as iliopsoas. Okay, iliopsoas, and this is main flexor of the hip joint. Main flexor of the hip joint. Now this flexion, whatever it is caused, that is the flexion of the hip. Okay, next you can see psoas minor muscle. So it is a very small muscle, but it is extending from 12 to L1 vertebra along with the intervertebral disc, and it is inserted into the pectinate ligament. Now it is a very weak flexor. Okay, so like this, these are the various muscles. Next quadratus lumborum is there. So iliolumbar ligament, iliac crest, and lower lumbar transverse process. This is the origin for the quadratus lumborum, and you can see the insertion where it is taking place at the transverse processes. Nerve innervation is T12 to L3 root. Now what are the important function? It will flex the trunk, flex the vertebral column laterally. Okay, so these are the functions of the muscles which are present in the posterior abdominal wall. Okay, so how you will, whenever you are doing the dissection, how you will identify the muscle? If you go from medial to lateral, first you will be getting the psoas major muscle. Okay, just above, or you can say just anterior to the psoas major muscle, a small muscle will be there, that is the psoas minor muscle. Next, if you go more laterally, then you will be getting the quadratus lumborum. Done. Come below, when you will get into the iliac fossa, at that time a muscle will be there, that is the iliacus muscle. So this is the way to identify the muscles of the posterior abdominal wall. Let me show you a diagram. Yeah, so this is the diagram. As you can see, first this is the psoas major muscle. Okay, then here you can see the iliacus muscle. Then if you go more laterally, then you can see the quadratus lumborum muscle. Okay, and here you will be getting the diaphragm. As you can see, these are the fibers of the diaphragm or the respiratory diaphragm. Okay, diaphragm is situated above, because we know the diaphragm or respiratory diaphragm is the partition between the respiratory cavity, between the thoracic cavity and the abdominal cavity. It is a partition. That's why it will be situated above. Okay, the respiratory diaphragm. Now the respiratory diaphragm is also important. As I said, it is a chief muscle of inspiration. Okay, along with that, it is also having some other function. For example, whenever we had to increase the intra-abdominal pressure, which is required for defecation, okay, parturition, all those things, at that time also diaphragm helps. Next, the diaphragm which is having partition, okay, between the thoracic cavity and the abdominal cavity, it is having some you can say perforation, or you can say some openings in the diaphragm. Now why these openings are there? Because we know that from thorax some structures are going to the abdomen. Can anyone name some structures which are going from thorax to abdomen? Any structure, whatever you have studied? Yes? Yes, esophagus is there. Esophagus from thorax it is going to the abdomen. Next, any other thing? Yes? Inferior vena cava is not going downwards, it is going upwards. Okay? So at least you know some structures which are going from thoracic cavity to the abdominal cavity, and you also know some structures going from abdominal cavity to the thoracic cavity. Now a partition is there. Now how it will go? It has to pierce it. So for that some openings are there. Through that openings the structures are going. Okay. Now this is the diagram showing the inferior aspect of the diaphragm. Okay, if you see the diaphragm, suppose this is the diaphragm, you are looking from below the diaphragm, then you will get this particular picture. Okay, now can you see this is the anterior aspect, this is the posterior aspect. Okay, so see, this is the origin, this is how the fibers are arising, and this is the insertion in the central tendon of the diaphragm. Okay, now can you see the opening? See, this is one major opening, this is one major opening, and this is one major opening. So mainly 3 major openings are there and some minor openings are there. Through these openings only the various structures are passing. Now why I am showing you this? Because today we will be discussing about the IVC and we will be discussing about the abdominal aorta. Can you see the abdominal aorta? This is a cut section shown over here. So abdominal aorta also passes through the opening which are present in the diaphragm. Same you can see the in IVC. It is also passing through the opening which is present in the diaphragm. And along with that you can see this is the esophagus which is also passing. Okay, so how they will pass if there is no opening? So that's why openings are given so that the structures can pass easily, and these are the major openings. So along with these openings, major openings, some other small structures are also passing, as you can see in the diagram. Okay, so the most important structure along with the aorta which is passing upward, that is the thoracic duct. Okay, so that is the respiratory diaphragm. Okay, so we have seen the muscles of the posterior abdominal wall starting from the psoas major, iliacus, psoas minor, quadratus lumborum, and respiratory diaphragm. Now you cannot include entire respiratory diaphragm in the posterior abdominal wall. Okay, because just the posterior part. Okay, which is present posteriorly. This particular part. Okay, this part will be included in the posterior abdominal wall. Okay, and the openings which I have shown you, these are very important because through these openings only the structures are passing. Okay, next we'll start with the abdominal aorta. Okay, so list of the structures I have shown you, among them muscles already we have discussed. What is the next? Next is the abdominal aorta. Okay, we'll be focusing mainly on abdominal aorta and the inferior vena cava. Now, do you remember last class I have written some points about a tubular structure? What are those points? Yes, so any tubular structure in your body, how you will be defining it? First of all, there will be origin, then there will be a termination. In between origin and the termination, the cords will be there. Okay, and then what will be there? Branches are there, and then relation. So these are the points. So same thing will be applicable for this also. Because aorta is a tubular structure. It is a blood vessel. That means it is a tubular structure. So all the points will be applicable. Not only over here, it will be applicable for IVC also. Because IVC is also a tubular structure. Right? So from now onwards, please make it a habit. Whenever you are writing notes anywhere, define that particular structure under this heading. That will help you to save your time during the exam. Okay? So as you can see, first I have written about the origin, course, termination. Okay. So what is the origin of the aorta? Okay. Before going to the aorta, have you seen the heart in the D hall? I hope you have seen the heart, everyone. You have not seen the heart? Yes, I know you have seen the heart. Okay. Now, what do you think? What will be the origin of the abdominal aorta? Any idea? See, abdominal aorta is not starting from the abdomen. Please keep that in mind. Abdominal aorta is not starting from the abdomen. It is the continuation of the thoracic aorta. So the aorta starts from the aortic opening which is present in the heart. Which chamber of the heart? Left ventricle of the heart. Okay. From there, if you see, it is having three parts. First is the ascending aorta, then the arch of the aorta, and then the descending aorta. These are the parts of the aorta. Now this thoracic aorta, when it is going downwards, okay, when it is going downwards, when it is just crossing the aortic opening of the diaphragm, it is called as abdominal aorta. So same aorta in the thorax, though it is present in the abdomen, it has crossed the respiratory diaphragm, it is called as abdominal aorta. Okay, so it doesn't mean that abdominal aorta arises in the abdomen. No, it is just a continuation of the thoracic aorta, right? Though it is in the abdomen, that's why it is called as abdominal aorta, right? So I hope you are not confused with the origin. Okay. Next, you can see the course of the aorta. Now, course means after arising, how it is going downwards. Okay. Obviously, it has to go downwards, right, in order to supply blood to the various part of the body. Now, how it is going downwards, in which side, right side, left side, okay, that you have to know, okay. So, it runs downwards slightly to the left. So, please note that the aorta which is there, okay, when it is going downwards, it is going slightly towards the left side of the median plane. Left of what? Of the median plane or the mid-sagittal plane, left side of the mid-sagittal plane. To the left in front of the lumbar vertebra and ends in front of the lower part of the body of L4. Okay, lower part of the fourth lumbar vertebra. That is the terminal part of the abdominal aorta. Okay, so once it is crossing the aortic opening of the diaphragm, then it is extending downwards. When it is extending downwards, it is situated on the left side of the median plane, and then it is extending up to the lower border of the L4 vertebra or fourth lumbar vertebra. How many lumbar vertebrae are there? 5 lumbar vertebrae are there. How many lumbar vertebrae? 5 lumbar vertebrae are there. Among them, it is extending up to the lower border of the fourth lumbar vertebra. Okay. Now, at that point, what happens? It bifurcates. It will terminate and then it will bifurcate. So, it will bifurcate into what? It will bifurcate into right and left common iliac arteries. Okay. As you can see, in front of the lower part of the body of L4 vertebra, that is approximately 1.25 centimeter left to the median plane, it is dividing into right and left common iliac artery. So that is the terminal point. Okay, so at that point, what it will do? It will terminate into two branches. What are these? These are the two common iliac artery, right and left common iliac artery. Okay, so this is the origin, course, and the termination of abdominal aorta. Okay, now throughout the length, throughout the course, what is the length? Approximately 10 to 12 centimeter. And what is the diameter? Approximately 2 centimeter. Okay. Next, in this diagram, I hope you can see, this is the respiratory diaphragm. See, this is the respiratory diaphragm. Next, can you see, this is the abdominal aorta. So, aortic hiatus is there. Hiatus means the opening. Aortic hiatus means the opening which is present in the diaphragm. Okay. At what level? Anyone? It is 12 thoracic vertebra. At the level of T12 or 12 thoracic vertebra. Okay. So here you can see it is extending downwards. Now when it is extending downwards, it is extending slightly on the left side. Okay. Next, it is extending up to, can you see these are the lumbar vertebrae? Just posterior to the abdominal aorta. Can you see the lumbar vertebrae? Yes. So when it reaches the lower border of the fourth lumbar vertebra, okay, fourth lumbar vertebra, at that time it terminates by dividing into two terminal branches. As you can see, these are the two terminal branches. That is the right and left common iliac artery. Right and left common iliac artery. Now further, if you see the right and left common iliac arteries, okay, again it will divide into internal and external iliac artery. Okay, external iliac artery will continue as femoral artery, which will supply blood to the lower limb. I hope you have studied femoral triangle, so you will be studying about the femoral artery. Okay, and internal iliac artery, as you can see, it is entering inside the pelvis. Okay, having two division, anterior posterior division, and then they are giving the branches which supply blood to the pelvic organs, the organs which are situated in the pelvis. Okay, we have seen the course and then we have seen the termination. What is left? Relation and branches. As you can see the relation. So how to study the relation that day I have told you? Do you remember? How we will study the relation? What is situated anteriorly, what is situated posteriorly, and what is situated on either side. This is a simple way to study the relation. Don't think also that what will be there in the relation, because abdominal aorta is not alone. That's why first I have shown you a very complicated critical diagram where you have seen so many structures are there, right? So what you have to do whenever you are studying relation of a particular structure, you have to keep it on middle and then you have to see what are the structures situated all around. That will constitute the relation. So here it is not that difficult, it is very simple. First you can see the anterior relation, okay, then you can see the posterior relation, then on the right side and then on the left side. This is the easiest way to study the relation. Okay. So what do you think, what will present anteriorly? So there are some structures which you have not even heard, but still you have to study. For example, iliac and aortic plexuses are there. Now, okay, I am coming into what is the iliac and aortic plexus. So, if you see the relation from above downwards. Now, please keep that in mind. In case of tubular structure, you have to mention the anterior relation from above downwards. Why? Because the blood vessel is extending downwards. It is not a small blood vessel like this. It is approximately 10 to 12 centimeter in length. Okay, that means some structures will be present in front of our upper part also, and some structure will be present in the lower part also. So you have to mention the name of the structures serially from above downwards. I hope it is clear. So first you can see iliac and aortic plexuses. Then if you go below it, you can see the body of the pancreas, along with that the splenic vessel, then third part of the duodenum. Okay, so these are the structures which are present anteriorly, anterior to the abdominal aorta. Okay, don't worry, I will show you a diagram. Posteriorly, you can see the bodies of the upper four lumbar vertebrae, corresponding intervertebral disc and anterior longitudinal ligament. So posteriorly, if you apply your common sense, क्या रहेगा posteriorly? It is the vertebral column. Which part of the vertebral column? Lumbar vertebra. So lumbar vertebra are there, then along with the intervertebral disc will also be there, and then this anterior longitudinal ligament is also there. Okay, this is a ligament which is connecting the bodies of the adjacent vertebra. Next, if you go to the right side, okay, so abdominal aorta is there, you are discussing the structures of the right side and then of the left side. So first, inferior vena cava is there. Always keep that in mind. Inferior vena cava is situated on the right side. Okay, inferior vena cava जो होता है right side में होता है. It is on the right side. Next, right crus of the diaphragm. This is a part of the diaphragm, respiratory diaphragm. Okay, right crus and left crus. Okay. Next, cisterna chyli is there. Anyone, have you heard about this cisterna chyli? Anyone, have you heard about it? Cisterna chyli? No, don't worry, I will show you. And then the azygous veins are there in the upper part. On the left side, you can see left crus of the diaphragm, pancreas, and fourth part of the duodenum. So these are the structures which are present on the left side of the abdominal aorta. Now, if you see the diagram, yeah. Now, can anyone tell me this diagram is of which section? Sagittal section. Okay. So which is anterior, which is posterior? So this is the posterior aspect and this is the anterior aspect. Okay. As you can see, this is the posterior aspect, this is the anterior aspect. So from this diagram you can identify the structure. So if you go posteriorly, as you can see, what are present? Lumbar vertebrae are there. What are present? Lumbar vertebrae are there. Now along with the lumbar vertebrae, you can see intervertebral discs are also present. You can see intervertebral discs are also present. Okay, and another important structure is also there, that is the anterior longitudinal ligament. Next, if you go anteriorly, so this is the anterior aspect. From above downwards, you can see the structures. So this diagram will help you to understand about the relation of the abdominal aorta. And these are schematic diagrams. That means you can draw in the exam, during the time of exam. Okay. Now, see, if I want to simplify it, as you can see, this is the anterior aspect. So first you can see iliac plexus is there. Then you can see body of the pancreas along with the splenic vein. if you go below, then you can see this is the head part of the pancreas, then you can see third part of the duodenum, okay, and then you can see coils of the intestine. So these are situated in front of the abdominal aorta, okay. That's also from above downwards. So whenever you are writing about the relations of abdominal aorta, if you draw the diagram, by looking at the diagram from above downwards, what are present anteriorly, you can write easily, okay. Next, one thing which is not shown over here and it cannot be shown, that is the relations on either side. Means what is present on the right side, what is present on the left side. Okay. So mainly if you see the relations which are present on the right side, first of all right crus of the diaphragm will be there, and then IVC. These are the two main structures which are present on the right side. Okay. Now if you see this particular diagram, so this is the diaphragm, this is the aorta. Okay. Now you can see these are the structures present on the right side, these are the structures present on the left side. Okay, this is also a schematic diagram. Now here you can see this is the cisterna chyli. Okay, it is a dilated lymphatic sac which is present in the upper abdominal wall. Okay, so the lymph which is drained mainly from the intestinal part. Okay, mainly from the intestinal part is coming over here, and the extension of the cisterna chyli is nothing but the thoracic duct, which is the largest lymphatic vessel of our body. Okay. Okay, so these are the relations. Next are the branches of the abdominal aorta. Okay, so we have seen the relation. The last part, that is the branches of the abdominal aorta. Now, so many branches are there. Okay, how to simplify it? For that, you have to categorize the branches. You have to categorize the branches. So, how many types of branches are there? As you can see, 4 types of branches are there: ventral branches, dorsal branches, lateral branches, and terminal branches. So, what is this ventral branches? Anyone? Ventral branches means the branch which is coming out from the anterior aspect of the abdominal aorta. Abdominal aorta is there. Okay, abdominal aorta is there. Suppose this is the abdominal aorta. If the branches are coming like this anteriorly, then these are called as ventral branches. Okay. Next you can see dorsal branches, means posteriorly. If it is coming out posteriorly, then these are called as dorsal branches. As simple as that. Then lateral branches are there on either side of the aorta. And then terminal branches. What is the meaning of terminal branches? Where it terminates. Okay, as I have shown you in the beginning. So like this, please categorize the branches and then study. You will never forget. Okay. So how many types of branches are there in case of aorta? 4 types of branches are there. Okay. Ventral, dorsal, or also you can write anterior, posterior, lateral, and terminal. Okay. So we'll see one by one. Now, before going to the in detail about the branches, as you can see, now here can you identify which are the ventral branches? Anyone? First, you can see these are the terminal branches, right? These are the terminal branches. Next, can you see this cut section, this cut section? These are nothing but this one, and this one. These are the ventral branches. Okay. Next, the lumbar arteries which you can see, these are nothing but the dorsal branches. Okay, which are coming out from the posterior aspect. Then this right renal artery, okay, then this gonadal artery, these are nothing but the lateral branches. Okay. So ventral branches, now always keep that in mind. Whenever a artery is there, you have named the branches. Now what will be the function of those branches? They will go and supply a particular area. Branches which are there, what is the function? They are carrying the blood. That means they will carry the blood and they will supply a particular area. Now which areas are supplied by which branches? That you have to know. Okay, so what do you think? What about the ventral branches? The ventral branches will supply the gut, or also you can say the abdominal part of the intestine. Okay. So as you can see, celiac trunk is there, superior mesenteric artery and inferior mesenteric artery. These are the 3 ventral branches. Okay. So in ventral branch, how many divisions are there? 3 divisions are there mainly. What are they? First is the celiac trunk, superior mesenteric artery and inferior mesenteric artery. Okay. Now here I have mentioned, as you can see, the celiac trunk, it is giving left gastric, common hepatic and splenic artery. Okay. So it will be supplying the stomach, it will be supplying the liver, it will be supplying the spleen and some part of the duodenum. Okay. Next, superior mesenteric artery, as you can see, these are the various branches: superior, inferior pancreaticoduodenal, middle colic, jejunal and iliac branches. Okay. So up to some part of the transverse colon, okay, few part of the transverse colon is supplied by this superior mesenteric artery. Next, inferior mesenteric artery, it supplies, as you can see, it gives left colic, sigmoid arteries and superior rectal artery. Okay, that means most of the distal to the transverse colon, okay, entire part of the GIT is supplied by this inferior mesenteric artery. Now, when you will study the development of GIT, at that time you will come to know about the foregut, midgut and hindgut. I don't know whether you have heard or not. You will be studying about that. Okay, foregut, midgut and hindgut. So when they are developing, at that time each and every part of the gut is having a particular blood vessel. So foregut, the structures will be supplied by celiac trunk. Midgut will be superior mesenteric artery, hindgut will be by the inferior mesenteric artery. Okay. So I am not mentioning about that because you have not studied till now the development of the GIT. That's why I am not mentioning, but it is accordingly. Foregut, midgut, hindgut, and these are the blood vessels. Next, so these are the ventral branches. Next, you can see these are the lateral branches. Okay. So in the lateral branches, mainly they supply the visceral organs. So what do you think lateral branches means? From both the sides, the arteries which are arising. Okay. Please note that these ventral branches, these are unpaired. Ventral branches are unpaired. That means only one branch. One branch they will arise and then they are giving different branches. Okay. These are unpaired. Next, mostly the lateral branches, they are paired. Why it has to be paired? Lateral branches, yes, because it has to supply both the sides, right side also, left side also. That's why they are paired in nature. So lateral branches include right and left inferior phrenic artery. Then you can see middle suprarenal artery, renal arteries and gonadal arteries, which include testicular artery and ovarian artery. So what do you think the inferior phrenic artery, right and left inferior phrenic artery, what will be its function? Please note that whenever the word comes phrenic, it is related to diaphragm. Okay, so in the nerve supply of the respiratory diaphragm, we have seen that phrenic nerve is supplying the diaphragm. Okay, here you can see phrenic arteries are supplying the diaphragm. So whenever this word phrenic comes, it is related to diaphragm. Okay. So as you can see, right and left inferior phrenic artery. Now this particular arteries gives of 2 to 3 suprarenal arteries also, which will supply the suprarenal gland, and then they are supplying the diaphragm, respiratory diaphragm. Next we are having the middle suprarenal arteries. They are very short arteries. They are directly supplying the suprarenal gland. Okay. Next you can see renal arteries are there. Okay, so renal artery, what do you think? It will supply which part? It will supply the renal arteries. Kidneys, common sense, it will supply the kidneys, right? So this renal arteries lies below the origin of superior mesenteric artery. Now if you see the origin of the renal artery, the origin is just below the superior mesenteric artery. Each of them gives the inferior suprarenal and uretral branches. Okay, so they will be giving inferior suprarenal branch also and uretral branch. The uretral branch will supply the ureter. You know that ureter is also there. Right, so it will be supplying the ureter and inferior suprarenal, which will supply the suprarenal gland, and then it will distribute it to the kidney. Okay. Next, these are the gonadal blood vessels, that is the testicular and ovarian. So in case of gonadal blood vessel, okay, in case of male testicular and in case of female it is ovarian. Okay, so if you see the testicular artery, it is passing through which part? It is passing through the inguinal canal, and it is a part of the spermatic cord, which we have discussed earlier in last week. Okay. And if you see the ovarian arteries are mainly placed when it is reaching the pelvic cavity, okay, through the suspensory ligament of ovary, it is reaching the ovary, okay, which is supplying the ovary. Okay, next dorsal branches are also there. Okay, so what is the meaning of dorsal branches? Dorsal branches means posteriorly, which are coming out posterior to the abdominal aorta. Now this includes lumbar arteries. 4 pairs of lumbar arteries are there. Okay, so lumbar arteries are there, 4 pairs of lumbar arteries. Now these lumbar arteries are very important because they are reinforcing the blood supply for the lumbar part of the spinal cord and the associated structures. Along with that, it also supply the lumbar vertebra. Okay. Next, median sacral artery is there. So this median sacral artery is also a dorsal branch, which is coming out from the posterior aspect. Okay. It is unpaired and arises from the back of the aorta just above the bifurcation, and it supplies some part of the rectum. Okay, so it is also coming out from the posterior aspect, just near the bifurcation, where the bifurcation of the aorta takes place. Posterior to that, it is coming out, the median sacral artery, and it is going downwards, and it is supplying some part of the rectum. Okay, so these are the dorsal branches. Next, lastly, the terminal branches are there of the common iliac. These are the common iliac artery, right and left common iliac artery. Okay, these are the terminal branches. Where the abdominal aorta ends, okay, the area, the part where it ends at that time, the arteries which arising, that is the 2 common iliac arteries, right and left common iliac artery. Okay, so as you can see, each common iliac artery bifurcates into internal and external iliac artery, as I have mentioned earlier, just anterior to the sacroiliac joint. Then what will happen? The external iliac artery in front of the pelvic brim serve to the lower extremity. When it will cross the inguinal ligament, the external iliac artery, when it will cross the inguinal ligament, it is called as femoral artery, and then it will go and supply the lower limb. Okay, internal iliac artery will go posterior medially into the pelvic cavity and will give anterior posterior division. And this anterior posterior division will supply the organs which are situated inside the pelvic cavity. Okay, so that is all about the terminal branches. Now here you can see the diagram. So in this diagram you can see these are the ventral branches. Okay, see, these are the ventral branches. Then these are the lateral branches. Okay, these are the lateral branches. The lateral branches mostly they are paired, present on both the sides, as you can see in the diagram. Okay, and then these are the terminal branches. Okay, the common iliac arteries. Next, just posterior to the bifurcation, you can see one artery is going downward. That is the median sacral artery. Okay, now along with the diagram, the diagram of the IVC is also given. Okay, where you can see the various tributaries of the IVC. Okay, so that is all about the abdominal aorta. Next is the inferior vena cava. Okay, next is the inferior vena cava. Okay, so what do you think? How we will study the inferior vena cava? In a similar way, the way we have studied the aorta. So it will also be having origin, it will be having course, and it will be having termination. Now, what is the difference? Difference is the direction of blood flow will be opposite in the inferior vena cava, right? Aorta, what it has done from heart, it is bringing the blood into the various direction, and inferior vena cava from lower part of the body, it will be carrying blood towards the heart. That is the difference. Okay, that's why origin will be at the lower end. Okay, so as you can drains blood from the parts of the body which are situated below the diaphragm. So respiratory diaphragm is there. Below the diaphragm, okay, the blood which is drained, that is drained by the inferior vena cava. Length is 20 to 23 centimeter. So here you can see the length of the IVC is more as compared to the abdominal aorta. Okay, diameter is 2.5 centimeter. Origin formed by the union of right and left common iliac vein. Okay, so right and left common iliac vein will join together to form the IVC. Okay, that also on the right side of the body of L5 vertebra. So what is the point of origin? L5 vertebra. Okay, that also on the right side of the body of the L5 vertebra. Once it is formed, it will ascend upwards. As you can see, vertebral column, it is ascending upwards, that also on the right side. Okay, then it will go along with the posterior surface of the liver, pierce the central tendon of the diaphragm. IVC pierces the central tendon of the diaphragm. That also at the level of 8 thoracic vertebra. okay, at the level of 8 thoracic vertebra. Now opens into the lower part of the posterior part of the right atrium. Now what is the termination of IVC? At the lower part, that also posterior to the right atrium, okay, after piercing the pericardium at the level of 6 sternocostal joint. So that is the termination of IVC. Okay, so you know that SVC and IVC, superior vena cava, inferior vena cava, they are carrying the deoxygenated blood from the upper half and the lower half of the body. Ultimately, where they are terminating? They are terminating in the right atrium. Okay, in case of IVC, it is at 6 sternocostal joint. Okay. Okay, so remaining part we will discuss in the next class. Okay. Now here you can see the this is the origin. So right common iliac vein, left common iliac vein, they are joining together to form the IVC. Now at which level? At the level of L5, and then you can see it is extending. That also on the right side. Okay. So IVC right side, aorta on the left side of the median plane. Okay. Okay. Thank you everyone.